Hi friends, welcome to a new series of AOCPMR podcast. I'm Meghan Mardashti, one of the AOCPMR's Multimedia Committee co-chairs and your host for today's episode. We started a new initiative earlier this year where we began to highlight patient stories by bringing them on the podcast. And today we have a special conversation lined up for you guys. We'll be speaking with Mr. Johnson, who is a patient who has experienced a brain injury. And through his story, we'll gain a first-hand perspective on the challenges that he's faced, his rehabilitation journey, and the role that physical medicine and rehab has played and is playing in for him to regain function and independence. We also have Dr. Keramati on with us, who is closely involved in Mr. Johnson's care and serves as the program director for the Sinai Hospital of Baltimore PM&R residency program. Alrighty, y'all. Without further ado, let's dive right in. Thank you so much both for being here today. Before we get started with questions, is there anything that you'd like to share?
I'm happy to be having this discussion and hopefully to inspire others.
Awesome.
Yeah, and I appreciate this opportunity to highlight Mr. Johnson's story. Truly remarkable person. And glad that we're able to highlight his story today for you all.
Awesome. Okay, I'm super excited to learn. Alrighty, so Mr. Johnson, can you talk to us, tell us a little bit about the events surrounding your brain injury and how kind of your treatment and the initial diagnosis was for you?
Yes. First, I want to start off with how I got my brain injury. I was I was at work and I was in a motor vehicle accident November 2nd, 2020. And I I received multiple skull fractures, facial fractures, fractured ribs. I was a passenger in the vehicle. I had my seatbelt on, and the driver was a co-worker of mine. We're in his personal vehicle, going to do an off-site job, leaving Baltimore. I work on the Port of Baltimore, and we had to do an off-site job at in Pennsylvania. While we were on our way to Pennsylvania, we were struck by a Mack truck who was speeding. He was recklessly driving, and he struck our vehicle. And he ended up dragging us a few blocks, and the car we was in was completely totaled with us in it. And they had the fire department and paramedics were there, and they had to cut the top of the car in half to get us out of the vehicle. And then I was it was in Pennsylvania. And then I was airlifted to Christiana Hospital in Delaware, where I had they found blood clots in my brain, and I had to undergo 2 brain surgeries. The first one, they removed the blood clots, and then few moments later or the next day, they found more blood clots. They had to operate on my brain again. And during all this time, I was still out cold. I was in a coma for a week. I was in the coma, and they finished operating on me, and then they were just waiting for me to wake up. And before, I'm telling you what's on my medical records and reports, but it may sound like I recall these things, but these are things that I was told by my doctors and nurses and therapists who knew exactly what happened based on police reports and whatever traffic cameras saw. But I was told all of this happened to me and my coworker, but I don't remember any of it at all. So I woke up in Christiana Hospital, not knowing why I was in there. I was in the hospital bed, and when the first nurse came into the room uh, to help me with something, I I tried to ask, um, why was I in here? What happened to me? What's wrong with me? And I could think of everything I wanted to say to the nurse, but I could not get those words out because I simply didn't know how to talk. And it freaked me out because I didn't know why. I had no idea why, and I had tubes all on my body. I had a trach, and I had a tube in my stomach. They were feeding me through an IV, and all this I woke up with, and I didn't know why I was even there. And the last thing I could remember at that point was driving to work, not even getting on the road to go to do the job. I remember driving to work, and then I wake up in the hospital. So that alone, well, I was going through a lot of emotions right away, like a right away. You know, where's my family? It was in the middle of COVID. It was at the height of COVID pandemic, and everybody was wearing masks all the time, and no one could visit me. And before I woke up, my mother and my wife, who was my fiance at the time, was calling the hospital to check the status, and I hadn't woke up yet. So all the doctors were telling them was, "We don't know, we don't know." And as a family member, that freaks you out for the doctors to say they don't know, right? And I understand that because with no knowledge of what's wrong with my loved one in the first place, the doctor telling me we don't know until he wakes up. It's kind of scary. So it was a very scary situation. I just wanted to tell you the listeners of like what happened to me. Those right away were some of the symptoms of being diagnosed with traumatic brain injury is that I couldn't talk, and then I realized that I couldn't walk. The nurses, anybody who's been in a hospital before, are familiar with that little panic button. They all put it on your bed, and they told me no matter what you do, don't get out the bed. Just hit the button, and we'll come see what you need. The problem was they didn't know. I'm naturally stubborn, and they they put a bathroom in my room right next to my bed. And at the time, I'm still learning what's wrong with me. So at first, I thought I couldn't talk, but my brain was telling me that I could get up if I wanted to because that bathroom was right there. So I swung my legs around to the side of the bed with no pain. I scooted myself out the bed and hit the floor right away. And then the doctors and nurses came rushing in. Why'd you get out the bed? Why'd you get out the bed? You know, I was like, I didn't know I couldn't walk. And that's the night I found out I couldn't walk. That was also a symptom of the brain injury. And then I realized all my life I've been right-handed. And the fact that I injured the left side of my brain, that affected the motor skills, defined motor skills on the right side of my body. It affected my arm, wrist, hand motion. My right leg was stiff, and I couldn't figure out why. And I was, I was trying to ask, did I break anything? Did I break my leg? Did I break my arm? I felt like I did because it hurt so much to move anything on that right side. There was the fact that I was being fed through a tube in my stomach was another symptom of me not knowing how to chew my food or even know how to eat. And to as a precaution, they fed me through tubes and gave me random swallow tests to see if I can like eat something soft or anything. And that in itself took a while. And all of these things that I was struggling with um, led to the diagnosis of TBI, traumatic brain injury. And I was transferred from the hospital in Delaware to Moss Rehab Hospital in Pennsylvania. So I ended up back in Pennsylvania, but to a rehab hospital where they specifically worked on uh, um, therapy, as in physical therapy, speech therapy, and occupational therapy. And I literally, I was in the hospital bed. I woke up every day, uh, and got in the wheelchair and got brought down to each one of my therapies. And the physical therapy is where I started to excel the most because of my athletic background and my competitive nature. I just wanted to like I just wanted to get out of there. To be honest, my thinking of not knowing exactly how I ended up in there, my mindset was, well, let me do what I got to do to get out of here and get back to my normal life. It wasn't as simple as I thought it was then. When I started putting in the work and being challenged on things that I thought were simple, so simple before the accident, I'm now struggling with at the time. So Moss Rehab is where I was at for I think 2.5 weeks. I went in a wheelchair and I walked out of it. So I got to go home. Thank you so much. I got to go home, and then I was assigned to Sinai Hospital for outpatient therapy. And that was like going to school. Transportation bus would pick me up every morning and take me to the hospital, where I would undergo physical therapy, speech therapy, occupational therapy, and visits with Dr. Keramati. And I was in a program called the Return Program.
If you're okay, I'll kind of delve a little bit more into our program, if that's okay.
Yes, absolutely.
Actually, before we start talking about the program, I just want to capture kind of some of the very valuable things that you shared with us regarding once you, quote unquote, gain consciousness after your surgeries. You know, like from a provider side or from like the other end, a lot of times it's hard for us to quantify those things, to understand truly what patients go through. And you did a wonderful job of painting what I would say is probably as vivid as it can get for us to kind of better understand the emotions that you experience, especially during COVID. I can imagine just seeing the mass, you're kind of in and out, coming out, you're like, what happened to me? You want to talk, you're not able to, you want to stand, you're like, what is going on? I was this person and now, and I think that also can be even more nerve-wracking. Like it's just a lot of emotions to process with this new chapter, new what is going on, and my heart literally sank. I had goosebumps all over as you were sharing that with us. So biggest thing, thank you so much. I think that I've never gotten a picture like that for me to just better understand what that can feel like, and it's so scary, and it's and I also want to, admire your resilience. I think the stubborn nature, I don't want to call it stubborn, but like resilient nature that you have with, I want to get better, I want to get out. That's what, most times we see tends to be our most successful patients who don't give up, who keep on pushing, because rehab isn't easy. A lot of times there are ups, but the downs can be really down too, and it's rarely a steady upward trajectory. There's definitely some troughs in the path, and again, those are really amazing features that you shared with us. So I just wanted to Thank you for that.
Thank you.
Yeah.
Go ahead, Dr.
And truly, like, coupling on that, like, Ms. Johnson, for your recovery, that resilience really has taken you through this entire rehab course that, like, patients like you got that positive mindset, like, you're just looking to keep going forward, keep pushing, keep searching for that new challenge and keep growing. Like, even with our most recent visit, like, you're still saying, like, working on some things to improve. That really has let you shine. We just kind of provided you the resources to show you what you needed to do next, and you just take it and you hit the ground running.
Thank you.
So just
Thank
to let
you.
So just to let the audience know a little bit more about our Return program, and it's an outpatient comprehensive rehab program that, just like Mr. Johnson said, it includes physical therapy, occupational therapy, and speech therapy. We also have a case manager and a social worker that's part of the program. We also have a vocational counselor and a rehab psychologist. And I feel like I might be missing something else, but yeah, those are the core, I guess myself, yes. That's the one I forgot.
Yay, that's important too.
Can't forget Dr. K.
Not important. And of course, the most important component of the program is the patients, like Mr. Johnson. And yeah, it is a kind of full day program where patients come in about like 10-ish a.m. and are with us all day until like 3 p.m. So it is exactly like Mr. Johnson saying, like, it is going to school, participating in those therapy sessions, doing some group sessions. I think during COVID, I don't know if we had too many other people in the program, but there are group sessions for clients to interact with each other.
Yes.
Kind of practice the social aspect of it, practice some of the conversations, ends up kind of being some good camaraderie there too. So, yeah, you kind of took all the resources we provided to you and you just hit the ground running.
Give me what you got.
Yeah.
Awesome. Sounds like a pretty well-rounded team. You said PTs, OTs,
Oh, absolutely.
physicians, rehab psychologists. I'd be really interested to hear more about that, because I feel like a lot of times we hear about the role of PTs and OTs, but not as much rehab psychologists. Both Mr. Johnson and Dr. K, feel free to answer this question. What is the role, I guess, more on like the clinical side, and your experience, Mr. Johnson, what did you found that to be helpful with?
The program there and the collaborative effort, you know, of the therapists and doctors and, you know, medicine rehab, the way they all work together in unison, whatever reports Dr. Keramati had with me, by the time I went back upstairs in the elevator, they already knew, and they already knew what to work on. Yeah, they already knew what to work on based on what Dr. Keramati reported. And they, you know, I get off the elevator and it's like,
and vice versa. A lot of times I'll hear, noticing some spasticity in OT. Okay.
Yeah.
I already have the plan to talk to you about potentially starting back with it.
So like the communication and the follow up, and it was like, oh man, I was like, it made things so easier for me to handle mentally. You know, the physical part is on me, and the cognitive thinking sessions, different exercises that I did with every therapy session, really, because even in physical therapy, Lisa had me walking the treadmill doing some math at the same time, you know, or reading, walking down the hallway, reading the newspaper backwards, you know, stuff like that was challenging, but I didn't feel any pressure, you know. I was, they had a way, the team at Sinai had a way of making me feel like not only motivated, but just wanting more out of, what I was doing, because I was experiencing immediate results. There was small improvements, but it was a lot of them. It was a lot of them, you know. Dr. Karamati would let me know right away without me having to ask what she notices that that's different or improved. She right away would say, okay, you raised your arm higher the last time she would help me remember um, where I was the last time I seen her, which is only like 30 days ago, right? And then she would say, "Oh, you improved this, this, and this. Oh, do you need to be prescribed with this anymore? How about this? Okay." You know, if things started going smoothly as I improved, much respect and props to the whole Sinai team, rehab medicine, and the the return program, because they all became my family, my second family. I was telling Dr. Karamati about plans to get married and buy a house and all of that, and then I did that. And the return program actually did just that. They was able to help me successfully return to work part time, and then now I'm full time. I started driving again and everything, which I never thought I would do. But I pointed out the fact that the collaborative effort really was due to really did a lot for my healing process and my success, because everybody was so positive and it didn't seem fake. It felt genuine. And I'm not one of those people that like second guess everybody. It's a thing that I felt, and while going through all the emotions of my recovery process, because I had times where I felt sad, I felt mad, I felt angry, I felt frustrated. I was going through all those things basically at the same time. And I felt like when I used to dread going to school or dread going to work, I actually loved coming up to Sinai for therapy. I look forward to that more than I look forward to like basketball practice, because I know they're gonna kill me. you know,
Aw.
I know they're gonna kill me, but Dr. Karamati's not trying to kill me. My whole recovery process was generally a great time. You know, through all the ups and downs mentally, I got through them, and I had a neuropsychologist. She was great. I forgot her name. Oh my goodness, I'm sorry. But she started at Sinai.
Oh yes, Dr. McWhorter.
Yes,
Yes,
oh my goodness. I'm sorry, Dr.
yes.
Mokota, because I know you're listening,
Oh.
and I'm sorry. I'm sorry. But she helped me a lot too, because I would talk to her a couple of times a month, where we would have sessions with her, where especially when I started back work part time. I would talk to her, Dr. McCorder, about how I'm feeling being back at work. She dealt with my emotional thought process, and how things are making me feel, how I'm working, how does it feel to be back, how you are operating now that you have this injury, things like that. And I was able to tell her all those things, and express other things that I was concerned about me returning to work, or my social life and family matters or whatever. I was able to talk to her about that, and how I may be struggling with those things, and she was a big help towards that, a really big help. And every single person every single person that was involved in my treatment um, really helped a lot, and I got a love for all of you, like for real. So, and I
Yeah.
appreciate, and the way I was treated, like the way I was treated, as far as the professionals uh, treating me as a patient just because that's their job, or treating me as someone they truly care about and truly want to see get better, and to see the future of how the patients they work with turn out, you know. And I take pride in that also because I'd be able to get invited to share my story about the wonderful people that God chose for me to get me back to where I am today. And I may not be 100% at things that I was before the accident, but I sure can tell, you know. And I choose not to think about it, so I will never tell of I will never notice the things that I still can't do. I'm using air quotations for the listeners, things that I can't do, because if I don't think about the things that I can't do and focus on things that I can do, I'll be so much better at that. You know, work with what you have is what they say, right? But God gave me a brain, and I kept my brain for a reason. So I had my whole brain still. You know, one side was injured a little bit, but with the work of the return team, all the therapists and Dr. Keramati, it was a smoother process than I imagined going into it. Because when I left Mars Rehab, when they told me I was going to outpatient therapy, I was like, oh man, more therapies, you know? But I knew I needed it, but I was like, this is every day, you know? But once I started going there, and the fact that I was so close to home, I was okay. You know, I was okay.
I'm
I
certainly a bit,
no,
oh, so I
yeah,
wanted to, I wanted to highlight like one other bit of like your rehab recovery. So you completed like the rehab program with us at Return, but we continued to work with each other, and we had some other kind of like small blips in the road. But we ended up having you also work with like rehab at work. I don't know if you remember that.
yeah. I
Yeah.
remember that. I remember that.
Yeah. And I was wondering if it would be okay if I mention kind of like some of a unique issue that we noticed with returning to driving for you,
Yes,
with like how you push on the gas pedal and the brake.
yes,
I don't know if you remember. I distinctly remember us sitting together in the exam room, and you had a wonderful like workers' comp case manager as well. She was absolutely fabulous and a great advocate.
yes,
Unfortunately, she retired.
yes. I know.
But we
I
were trying
know.
to figure out why you were having some struggles with like driving and kind of going from like the brake to the gas pedal. And I believe you were mentioning like you just kind of pivot on the heel of your foot to go between
Yes.
the two. And that was, as a
You
short
remember?
person, something that blew my
Yeah,
mind.
that's exactly what it was.
that that I need to lift my foot off the gas and put it on the brake. I need to actually like move my foot.
Yeah.
So that was kind of like a unique thing that we found out that that was that small little thing, that little adjustment that you needed to
Yes.
do to improve the issue. And I
Yes.
believe that there was a person at rehab at work that put like a bright like tape or something in your
So,
car.
so yeah,
Do you remember?
the specialist that was working with me when doing the driving, since we were using my personal car, he put uh yellow high visible tape around the brake pedal. So if I quickly look down, I know, okay, that's the brake. You know, because my right foot, as I explained earlier, my fine motor skills on my right side was a little off. So the feeling of where my foot wasn't quite there. So I'm pressing down on what I think is gas and it's a brake. And then when I try to press the brake, I slammed on the gas, and it freaked me out. It freaked me out. So like, but rehab, aside from doing the actual driving test, rehab at work also helped me with the small things like um, uh, uh, reflexes, my reflex reaction, awareness. They had a model car that I sit in and practice pushing the gas pedal, brake pedal without looking down and things like that. But that type of activity and repetitiveness really, really helped. Like I don't like, have an issue with my foot being on the right pedal. I do still have, while we're here, Dr. Keramati, I still have might as well, right? Because this is the conversation me and Dr. Karamati have during our visits. Things that I'm still a little concerned with, and things that I've gotten so much better in, and I've gotten so much better in driving. I still have moments where I have a little anxiety when driving on the highway, not because um, I I wouldn't call it what's the word trauma. I wouldn't call it trauma because I don't remember the accident. However, driving on the highway with so many cars, it tends to hit the switch on anxiety sometimes. So I managed to pace myself in meaning how far I go, how far I drive. Do I drive locally? Can I drive to work? I started doing things like my wife or a Lyft driver would take me to work. And when it comes to locally, if I go to the store or get the oil change or things to do things like that, I drive myself. I'm more confident driving locally. Um, that was the only update I have for you, Dr. Karamati. And,
Oh, okay.
and for everyone listening, those are the things. 5 years after my accident, I'm still, doing self therapy and still visiting Dr. Karamati and having talks with her on progress made or concerns I may have. So, um, yeah.
Wonderful, wonderful. This was very wholesome.
Yeah.
I think they touched on some, what I like to think are the big flexes of the rehab world. And that the biggest one is the collaborative nature and the
Yeah.
communication, because it's definitely been, I think talked about actually on the podcast before, where being on the same page, but also making sure you're communicating with the
Yes.
PT, with the OT, with the other rehab members, having everyone on the same page. That is what the individualized patient care is about. That is what truly empowers a patient to be as involved in their care, but also just have a better understanding of what they need to do to better
Yeah.
succeed. And I love the piece of where you mentioned, in the elevator, you're going to your PT, they already know what to do. Dr. Keramati
Yeah.
is also like knows and is aware of what happened in PT, whether there was like some
Yes.
toxicity or not that needed to be kind of looked at more closely.
Yes.
And another big piece is the emotional burden that comes with it. And having a rehab neuropsychiatrist or neuropsychologist can be so beneficial when you are experiencing or you've had a TBI, because you are navigating pretty much uncharted territories. You haven't had this, dysfunction before, all these emotions coming to surface. What happened? That could be anger, confusion,
Yeah.
feeling isolated because, you have your family there, but I can, imagine it must be hard because I have my family, they can support me, but they still don't understand what I've been through. And
Yes.
having, your empathetic rehab team close to you will almost equip you a bit more to go through this journey a little bit less alone. And of course, doing, especially I know in OT sessions, sometimes they bring on other patients. So whether you're getting like some of that social interaction piece, but also hopefully feeling less alone in your journey because you're like,
Yeah.
okay, these are other people that can relate
Yeah.
to what I'm going through.
Yes. That's what I'm mostly grateful for, is that the social aspect, right? And because that goes a long way. And the where I got the most experience of that is the return program, where they talk to you a lot as a group and as one on one. We do we did group activities together. I've gained friends in there. All everybody with a brain injury in one room with one goal is to get better. And I really appreciated that, because it was we're a part of a community. We're our own community. And I was like, there's so many of us and we all have different stories, but we
Yeah.
all we're all survivors though. We're all survivors. If we're all different, come from different backgrounds, different languages, different religions, all the same, all that, but we're all the same because we're all survivors, and we're all the same because we all have the same goal, is to get better and to get back to our regular lives. Because I rather say regular than normal, because what's normal, right? But regular lives, which means things that we were used to or comfortable with, but life sometimes can be uncomfortable because it's supposed to be. It's just the way it is. And I hated to hear that growing up, and now I'm the one saying it. You know what I'm saying?
Full
So
circle
I
moment.
just
Right.
yeah, I just really appreciate the camaraderie and the how the team really works together and communicates with each other, and the way they treat the patients. Because I'm talking about how I was treated, right? But I'm also very observant, and I also witnessed how others are treated that were in the return program. All the patients that would come into office when I leave said office, and we all treated exactly the same. Like it's like no sweat off your back to be empathetic, to be genuine, to have care in what you do. That not only shows in your work, the results in the patients who work with also show. And
Right.
there'll be times where it may feel like you're getting ready, your life is gonna change. Your life is gonna change for sure when you get into this. And you'll have those patients that are gonna have a really, really tough time, right? A really tough time. And it may or may not make you think or question yourself, like, what am I not doing, right? Or
Right.
what am I doing that I shouldn't be doing? What, like, I spent so many years in school. I dedicated my life to this, and now I'm working with live patients, and I can't get to seem to get this patient to uh, make something work, something that I'm working on. When's it gonna click, right? And I'm here to say, as one of the survivors, that it's not it's not what you're not doing. It's not what you are doing that you shouldn't be doing. It's a collaborative effort, and that's what I like about the whole process. That's why I keep bringing that word up, because me and Dr. Karamati actually worked together. She told me things that she noticed that she's going to work on and prescribe me with, and assign me with certain tasks to do. And then and then I have to do that in order to see the results. And when I see her again, we go over what got better and what to continue to work on. You know, that communication goes a long way. And the fact that I always had that communication, always, till this very day, I'm still getting that communication means a lot to me. And it's something that I never would have thought of, let alone get into an accident, having a brain injury, but being treated how I was treated and how I'm being treated and being able to talk and speak in full sentences right now and
Mhm.
look and feel and see and smell and touch and walk around and run. And I ran a little bit. It felt good. Yeah.
Yay!
A light
Nice.
jog. A light jog. A light jog is also a light flex. So
Right.
Nice.
I'm jogging now. Yeah. So,
Nice.
but that communication goes a long way, and it's a collaborative effort between the specialist and the patients, and it's really hard for the patients. And most patients may say, "Oh, you're the doctor. You don't know what I've been through physically, right?" But you do know because you work with so many people that in you and empathetic about what you do. You start to feel that. You start to feel that, and you start to wear that. And I pray that none of you take that home with you. Because that can get really depressing within itself. It's all a mental thing. We all have you're dealing with people with brain injuries, but it's all mental, right? It's all mental. How are we dealing with the recovery, and how are you dealing with helping people recover? It's all like it all goes together, and I pray that more of the survivors like myself um realize that and really don't get too down on yourself and or the people who are trying to help you. At least I can speak for Sinai Hospital and Christiana Hospital because my neurosurgeon is now my brother. You know what I'm saying? My neurosurgeon is the same age as me, and his name is Tony. Because
Wow.
everything happens for a reason. So I just had to throw that in there.
Definitely. Yeah, and I love that it's the collaboration always, always, you, Mr. Johnson, patient, whoever, you all are the center of the collaboration.
Yeah.
Have all the team members in the world, but yeah, you are the center of it. You're always driving it, and you gotta, talking to the listeners here, like, gotta listen to the patients. We
Yes.
have to
Yes.
work with the patients. Set your ego aside. There's no
Yeah.
place for it in this field at all. You
That's
work with the
all.
patients, listen to them. Everyone has a really unique journey, and we're just there to help them along. And Mr. Johnson, you mentioned already, you take what we say and you just run with it.
Yes.
And I wanted to bring up that story about the pedal because your situation was just so unique. We had to think outside of the box. We had to
Yeah.
listen to like your process with it and just kind of see what we needed to do to tweak things to make you more independent.
Any survivors that's listening, that's working on speech, their speech and going through speech therapy. Um, it took a really long time for me to not be ashamed or mad at the way I speak if it doesn't sound like how I spoke before. None of you knew me before the accident, but I kind of spoke different, as far as my tone, how I pronounce things and stuff like that. However, you'll never know that it's actually gotten better. Certain things that I pronounce are way better than the way I pronounce certain things before the injury. I was like, I
Wow.
gotta, I gotta take the good with the bad, and that's with life.
Right?
One of the gems I heard during the return program is that be grateful for everything you do have. Utilize and be grateful for everything you do have, and be sorry for nothing. And I didn't understand that at first, right? But when I go outside of the return program and start talking to friends and coworkers, I always would have a disclaimer before I speak, because I wasn't confident, and I didn't like the way I talk at all. So I would say, oh, uh, please excuse me if I slur my words, or if I stutter sometimes. I'm not high. I'm not drunk. I would say that every time. I would say that every time before I talk to somebody, and people will look at me like I'm crazy, because they couldn't hear what's wrong with me.
Right.
I was my hardest critic, and we as the people tend to fall into that. Sometimes we are our own toughest critic, and while other people are saying, "Oh, you sound great," I'm thinking, no, I don't. I'm still working on it, but thank you. Oh, you're just saying that, right? You're just trying to be nice, right? I gotta get better. So that's me telling myself that, because I don't like the way I sound, but not realizing that I'm actually getting better. So I started to not think it that way, and proceeded to then started to receive the reception that I was getting of positivity. When I speak, when I tell people my story, they say, I would never know you went through anything if you didn't tell me. And
Right.
I couldn't see that at first. I'm like, how do you not know? Look at my head, look at why I talk, look at the way I walk. But that person doesn't know me. So they don't know the difference. But even people that know me, that I've seen after the accident 5 years later, they can't tell. Hold on, when was your accident? 5 years ago? Wow. So what happened? You couldn't talk? Wow. I'm telling them this, and while I'm telling them this, I don't like how I say I'm telling them that, but they're like fully in tune, you know? Like, well, tell me more. Like, this is great. So it's that kind of reception that continues to build me up as I continue to get better. 5 years later, I'm still getting better. I'm still working on getting better too. Not in a stubborn way, but in like a prideful way. Like, I'm so proud. Let's keep it going. You know.
Right. Yeah. This is pretty important because there's a quote, I forgot if it's like, if you're not getting better every day, then you're getting worse. It kind of goes hand in hand with that. And life is a big journey, and you can make it what it out to be. There is definitely kind of what you touched on a little bit, the victim mentality, or more so like, oh, this sucks. And I definitely think there's like a place for that, but also there's the other aspect of, this has happened. I'm going to be great. I'm going to make something great of it. And that is so powerful. And absolutely, that's something that you have done.
Yes.
And of course, it's
Thank
important to, And it's important to consider the amazing support system that you have along the way that allowed you to, reach the milestones that you have had. And another wonderful thing is, as sometimes we forget, I feel like personally for myself, for instance, I have worked with patients who've had TBIs, and I sit there and I'm thinking, man, how am I able to connect with have that genuine connection with someone who has gone through such a traumatic event, right? And I'm sitting here able-bodied, and I think your story almost simplified me sitting there, or just simplified how I've overthought this whole thing.
Yeah.
In a sense that human emotions don't change. We all feel scared. We all feel lonely. We all have these emotions, and you don't have to have a brain injury necessarily to be able to connect with someone who's experienced that. And Dr. Keramati also mentioned, putting your ego to the side, focusing on the patient.
Yes.
And these are wonderful ways that as future providers or current providers, we can connect to our patients. And you both did a wonderful job of painting a very holistic image of, more the clinical side and from personal experience, what rehab, what PM&R does for patients who've had a TBI or brain injury experience. And you also kind of talked about what are some of the important things for us to consider when working with patients and understanding what can entail in that long-term journey of someone who's had a TBI. Kind of to wrap things up, I'd be interested to hear if you guys have any final words or pearls of wisdom for healthcare professionals in PM&R, whether a medical student, residents, already attending, who want to better advocate for patients with brain injury, both in the clinical setting and in the broader community. What are some things that come to mind for you both?
Yeah, so well, I could speak from a patient slash survivor standpoint. There is joy in recovery. If you first find joy in surviving, there's joy in recovery because there's no space for sorrow if you're still a living being and you're able. Now, when I say able as a general statement because if you're able to do anything, you may lose abilities to do certain things, but if you're able to do anything, then you need to take pride in that, and be, work with those who are working with you, and you'll start to see the results. Work on having self-awareness because that goes a long way. Notice when you need to work on things instead of feeling bad about it, and just simply work on it. And when the medicine rehab team tells you they're going to start working with you on certain areas pertaining to your injury, not only believe that, trust in that, but also work towards that because the outcome, the results are so much more fulfilling when it's a team effort. That's from the patient's standpoint.
Love it.
Yeah, I have nothing else to add. That was beautiful, Ms. Johnson.
Thank you.
Thank you. Mr. Johnson, you are a true ray of sunshine and an amazing source of encouragement. And I think anyone who's listened, I'm sure we all have our bumps in the journey, the hardships we go through right now. This is, dedicated time for a lot of medical students, and dedicated, that's where people are studying for like board examination, and things can feel very tough in the moment. But I think what you've shared with pushing through, and there is joy in living and joy in the things that we can do. It truly puts everything in perspective. And at least for me, sitting here and listening to you allows me to really count my blessings and count the amazing people I have in my life that have helped me to get here. So thank you so much for being here, for sharing your story with us. And Dr. Keramati, thank you so much for painting a humanistic side to medicine and sharing how things you've done has been, been part of Mr. Johnson's wonderful journey.
Absolutely. I just want to thank you so much too for this opportunity and allowing me to share my testimony. And I just want to congratulate you too on the podcast. Not only the podcast, but your upcoming career. Because the fact that you created an avenue for survivors like myself to share our story, not just as a promotion, to your medical team. No, not at all. This is actually like This is really helpful. Having these discussions is worth it because there's so many brain injury patients out there. So many people living with a brain injury, living with it. And these types of testimonies from patients and different doctors and stuff who work with these types of patients is it's amazing. It's amazing. And it's going to go a long way. It's a good thing you got going. And so I congratulate to you on that, and I thank you again for this opportunity.
Of course. I can't take all the credit. I do have to give a big shout out to AOCPMR, which is our organization that has, provided the platform and has allowed me to be one of the hosts for our amazing podcast. And yeah, I definitely think there's a lot of lessons, important lessons that we can learn from our patients. And if I can use our, AOCPMR platform for that area, for that purpose, that would be definitely a joy for me. So, and hopefully our listeners have been able to enjoy today's episode as much as I have and found it as helpful as I did. And if you guys have a few seconds, feel free to our listeners, feel free to leave a review on our Spotify or Apple podcast page and let us know what you'd like to learn more about in the future. Thank you all for your time, and until next time.